Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I am a diagnostic and interventional radiologist working in Erbil, Iraq. Yesterday we published a case about a 21-year-old male patient presenting with low back pain and right-sided lower back pain and fever. And we saw the images. We will discuss the findings now. The main finding is, as we said yesterday, it's in the axial T2 weighted fat saturated images, and you can see here that there is an abnormal hyperintense signal seen involving mainly the iliac side of the right SI joint and a small amount of bone marrow edema involving the sacral side of the right SI joint. This hyperintense signal indicates bone marrow edema. So bone marrow edema usually indicates some sort of bone inflammation or bone irritation or even contusion. However, the more significant finding here is, I just want to show you this one, which is maybe a little bit better. Okay, there is this hyperintense rounded signal which signifies fluid or a collection, and it appears to be arising from within the SI joint, bulging on the anterior aspect of the SI joint. You can see it here, and let's try to see it on the sagittal images if it's obvious. No, it's not very obvious here. We will not use this one. Let's see the coronal fat saturated image. You can obviously see that there is a fluid collection arising from within the SI joint, bulging into the pelvic cavity. So these findings in combination indicates obviously there is a right-sided sacroiliitis, and there is evidence of collection seen, and you can see it even in the T1. You can obviously appreciate that this collection here is passing from the SI joint into the pelvis. So this indicates sacroiliitis with abscess formation, or in another word, suppurative sacroiliitis. Most likely it's self-bacterial origin. Brucellosis is a possibility. Pyogenic infection also is another possibility. The main idea is that there is a collection from the SI joint suggesting, and you can see it's extending into the iliac fossa on the right side, indicating a collection or abscess formation from suppurative right-sided sacroiliitis. One of you guys suggested that I show you the report that, or how this case was reported, so that you get more oriented. Some of you who needs help will be more oriented on how to write the radiology report. Personally, I'm in favor of writing a short, concentrated report. I don't like the long reports that have a lot of normals and a lot of no significant or no clinically significant words or sentences. So in this case, my own report was there is a marked bone marrow edema seen involving the iliac side of the right SI joint and less severe edema involving the sacral side of the right SI joint, with an evidence of right SI joint effusion with the fluid bulging from its anterior aspect, forming a collection extending in along the SI joint, measuring 2 by 1.5 by 6.5 cm in dimensions, and it's most prominent at the inferior aspect of the SI joint. Findings are indicative of SI joint infection with abscess formation. Normal left SI joint, normal hip joint bilaterally, and there is no free fluid in the pelvis, and normal urinary bladder, and no other remarkable findings. So this was our report. Thank you very much for listening. Wishing you a very nice time. Thank you.